I came in with my glasses on, and I obviously I walked out without them, and I could see as if I had my glasses on. I wish I did it sooner. I'm very happy that I did it.
Well, I want to formally, well, we've been sort of chatting, but I want to formally welcome everybody. My name's Dr. Lindahl, and I'm the owner here of the Rochester Eye and Laser Center. Kim Fullone is my clinical supervisor, and she heads up all of my clinical services. We don't just do LASIK here. I do cataracts, corneal transplants, glaucoma work, but largely it's cataracts and LASIK. And then finally, I want to introduce Brianna. Her last name is Ferranti? So she, for the last 3 months, we've added a patient that we've done recently who's willing to come on and answer questions that you might have just from a patient perspective. We don't prompt her in any way. We have some questions. She's going to answer them the way she wants to answer them.
So Brianna, could you tell us about the first time you came here for the consultation and how it went and just your view of that?
Yeah, so first I just want to mention like what you mentioned in why I decided to come in for a consult at your practice is because of the information about the fact that you do have some of the latest technology in lasers and that you do have like a staff of nurses. And also I attended one of these webinars, and the combination of those three things gave me that initial, like I felt comfortable. I had more information. I was able to like percolate more on whether I wanted to do it with more information than I ever would have thought I would have had. So that started me off with a certain comfort level. And then I went in for my consultation to get my eyes scanned to make sure my retina was the right
Cornea.
was in good shape for it. And that was, didn't take long. It was pretty easy. And like Kim said, everyone throughout the whole process, consultation, surgery day, follow-ups, with any questions or anything, everyone's been very friendly, very professional, knowledgeable, welcoming. I've just felt very comfortable the whole time. Any questions during my consult that I had were answered, again, with seemingly a lot of knowledge, and I left feeling better and good. And I was excited because they were like, I'm pretty sure you're a good candidate. And then I booked my surgery.
And in pre-op, all we do is came in and we review all your eye drops you're going to have to take after the procedure, and we review what to expect in the room. And then we clean your eyes and we give you a couple eye drops, and then you're ready for the procedure, which now Brianna will talk about next.
So the procedure was really cool. They did tell me, I do remember that, like she said, that they will prompt you like everything they're going to do. And I was just like, okay. But then when you really get in there and they start doing that, like I really appreciated that. They were just like, here's what to expect. Okay, you're going to feel this or you're going to feel that. And it just gives you that mental, like you can prepare yourself. But overall, it was like painless and quick. Honestly, I felt it was just so cool. I was like in awe of how quickly and efficiently these doctors and these machines, I can come in not being able to see without contact lenses, and then I can leave with in a few hours being able to like see with almost perfect vision. So the procedure was very quick, very painless. There's people on all sides of you. You feel supported. Again, you feel prompted, which gives you that mental preparedness to see, like, so you know what's next. It just was a very calm atmosphere, and I felt it went really well, and I left like very elated.
Well, thank you, Brianna. So we basically tell you in pre-op that there's going to be like 2 steps in the room. There's going to be making the flap, and then there's going to be the actual ablation. And during the making of the flap, there's a suction section part of it that you actually feel like when you were a kid and you had goggles on and you pulled those goggles and you felt that weird feeling. I don't know if you guys all did that, but I did. But it feels weird. Do you agree that that was like a weird feeling, and but you were able to get through it and like breathe through it, and it lasted very little time?
Yeah, is that the part where you felt like the pressure?
Yeah.
Yeah, you feel it, but you just know that, like, I don't know, for me, I was just like, this is what I signed up for. It's really not bad, and it was really quick. It just, you just feel pressure, nothing bad at all.
And basically, that's the hardest part. Do you agree? Of the procedure? Okay.
Yes.
And that part lasts less than 30 seconds per eye. And the reason you're feeling that suction is because the machine is actually holding your eye still so that we can make that flap. So it's kind of holding your eye so that the flap is able to be made. So it's important to keep everything still at that point, and that's why you're kind of feeling that pressure step. But everybody I talk to, when we tell them in pre-op you're going to feel this, they get nervous about it, and then afterwards they're like, it wasn't that bad. And basically the rest of the time, Dr. Lindahl is just talking in your ear and saying, okay, look at the light, look up, look down, stay still. The whole time, right, Brianna? He was just kind of talking to you.
Yeah, and he just has a very calm, like, confident energy and voice, and it helped a lot.
Right. Anything else to add from being in the room?
Just that they were very, like, doing anything to make you comfortable. I think they asked me if I needed a blanket, or they told me to dress warm. Like, they just were very attentive, and I really appreciated that.
Thank you. But so right after the procedure, we bring you into that other room. And so do you remember being able to see better right away? Like,
Yeah.
what were you seeing right away?
I think I remember looking at the clock and being able to read the time.
Okay.
Yeah.
So it's almost like when you come out of the procedure, you're still blurry because we just did the procedure and there's some inflammation going on, but you can blink through it and already start to see better. So it's like all of our patients are like, oh my gosh, like right away, you're not seeing what you're gonna see the next day, but you can already, once that fog lifts and that inflammation gets better, you're gonna already notice a difference like right after the procedure, which is really cool.
Yeah, like I came in with my glasses on, and I walked out without them, and I could see as if I had my glasses on. I just was still a little loopy.
Yeah. All right, so now tell them, we usually tell our patients after the procedure, you're going to hate us for about 4 hours. Don't Google review us at that point. Wait until after that 4 hours. So, Brianna, tell them without holding back what you felt in that 4 hours of recovery that we kind of explained. It's not going to be pleasant. How was it for you?
Honestly, it was not bad because it was everything that they told me to expect. Just on the way home, it was just as I was driving from the office to my home, it just felt like, like something's in your eye, like you kind of, the light irritates them, you want to close them, just like sands in it kind of. But then as soon as I got home, as they instructed me, I just slept I was in the morning. I probably got home around 10 from the procedure and napped till about 3 or 4, maybe like 4. And when I woke up, I could open my eyes. I could see as if I had my contacts in and did not have that sensation anymore. Like I could open them. They weren't watering. I mean, they felt a little sensitive, but like no pain or anything like that.
Perfect. And that's what we tell you. We kind of say, okay, and some people the next day come back and they're like, you lied to me. It was so easy. But we tell you worst scenario. So this way, if it is the worst scenario, some people don't have any of this, but some people do. So we tell you worst scenario. We basically say that it feels like you have something in your eye, like you put sand in your eye, and it's tearing and burning and yuck. So the best thing to do to prevent that feeling is to get home, jump in bed, cover the windows because you'll be light sensitive, and go to sleep. And if you have somebody that's there with you, have them just come in, give you your eye drops that you need at the time. It's about 2 hours after you get home. And then you go right back to sleep. My husband's actually an anesthesiologist, and he was blind, like literally blind. He was a -9, and he had the procedure done in August, so it was great for me to be able to see what people really go through when they go home. And he was just light sensitive. He was like, I didn't have any of the pain or anything, but he felt light sensitive. So I just put blankets over the curtains like that we already have to cover the windows, and he was fine. He went to sleep, and in 2 hours I went in and I'm like, open your eyes, gave her drops, and then he went back to sleep. He woke up and he had dinner and he was totally fine. A different person. First time in his life that he was ever able to get out of bed without a pair of glasses on.
Let me just, if I could just interject a couple thoughts, because I don't want people to misunderstand a couple of things that I heard. And Brianna's done a great job at just telling it like it is for her, which is wonderful. She did say that when she was driving home, and I want to make it clear that she did not drive home. It's
the person driving.
Okay, so you're not going to drive home. You're going to drive the next day, but she was driven home, and that's what she felt. So that was one thing. The other thing is that Brianna said she went to bed around 10 o'clock and she got up around 4. Now, we don't recommend you stay in bed for 6 hours. We recommend you get up at the 2 hours, take your drops, then if you want to go back to bed. So I don't know whether she did or not.
She did.
I was a good patient.
Was she a good patient?
She did do that.
Okay, so because you might have misunderstood that, but because we really, you got to take the drops, and the 2 hours will get you over the hump of those symptoms of the tearing and sensitivity to the light and that, but it's not quite all the time. Like Kim says, for typical patients, it's that sort of 3-4 hours, and then you feel fine. Yeah.
Yeah, I was thinking that, Brianna. I'm like, oh shoot, we should probably say she was a passenger in the car.
It feels so long ago. The details are like not fresh.
You did awesome, and we appreciate it because that's what we want. We want you to tell them.
The last thing I want to, one thing I want to ask Brianna, because everybody comes in with different expectations. You indicated why you felt comfortable with our practice, and I appreciate that. But what was it? Why did you really want LASIK? Forget about how good or bad we are. What did you want? What were your desires to get out of your vision? Because everybody, I want you to think about this.
I've been wanting it for years and years and years, like a long time. When I heard of it, it was in the back of my head because I'm just a person like that just like, to me, it's almost like work smarter, not harder. It was just always a pain to make sure I had my contacts. Like, they would get dry, they would pop out, or if I was like away one time and I lost one without, it was just like, it just was more cumbersome in my life. And I figured if I could do a surgery that's like, has lasting effects, I don't have to deal with any of that anymore. And I could see perfectly, just one less thing in my life that I have to like worry about.
Sure. Well, that's good. Yeah.
And then how is it now living without contacts and glasses and worrying?
I love it. I highly recommend it to any of you on this call that are thinking about doing it. I highly recommend it to my clients that come into my practice. I wish I did it sooner. I'm very happy.